This morning, we're one-on-one with Congressman Anthony Weiner, a leading advocate for health care reform in the House, who believes the controversial bill still has a pulse.
This is the Emmy Award-winning 11 News Close-Up with your host, Marvin Scott.
Good morning. As Republicans see it, health care reform is President Obama's Waterloo. With the Democratic loss of their filibuster-proof majority in the Senate, critics would like to think the measure is dead this year. But Democrats say, not so fast. It is still possible to reach a compromise on a measure that would assure all Americans adequate health coverage. New York Congressman Anthony Weiner has been one of the leading advocates for the measure in the House. Newsweek magazine has described him as, quote, the voice of the left on health care reform and the poster child for a single-payer option. While he encourages Democrats not to abandon their efforts, he is urging his political colleagues to heed the message of Massachusetts, which elected a Republican to take the late Ted Kennedy seat. Weiner is calling for legislation to focus on job creation with a health care element added to it. Now in his sixth term, Congressman Anthony Weiner represents a district that includes neighborhoods in Brooklyn and Queens. Good to have you back on PIX News Close-Up.
Well, it's great to be with you on Valentine's Day.
Let's get right to health care. A lot of controversy, a lot of confusion. Now, I know you have a passion for health care reform. You've voiced that over the past year, but also you're a political realist. At this point, is health care reform, is it dead, or is there still some life to it that it can come about?
Well, health care reform kind of lies in the hands now of our big clerk, Mariano Rivera, this debate, which is President Obama. If he steps in and says, look, these are the 2 or 3 important things that I need to have in this bill, and puts his finger on the scale, I think we can still save it. I think part of the problem that we've had up to now is that we've been focusing too much on how you get that 60th vote, how you make the sausage of legislation, without realizing that 200 million Americans are watching this process who really care about it, who don't understand it. And I think that to some degree, the President, we in Congress are to blame for that. That's what I was talking about when I said we have to learn the lesson of Massachusetts, and we have to be much clearer. We have to say, look, we're trying to do 3 things. One, we're trying to get coverage for people that don't have it. Why is that important? Because right now they're getting health care, but we're paying for it. They're going to hospital emergency rooms. The bills aren't getting paid. We in New York pay $6 billion in extra taxes to take care of them. So that's one thing we're trying to do, and we're doing that by giving them subsidies to buy insurance. Secondly, for the rest of us that have health insurance, we want to make sure our insurance companies treat us a little better. They don't throw us off when we start to have needs. They don't discriminate against us. That's also fairly easy to do. In fact, a lot of the things we're trying to do in the national bill, we already have here in New York. It's the third thing that has become complicated and very important, and that's also where the Republicans have come up with no ideas. How do you control costs? We can't keep having our health insurance costs go up and up and up every single year, $1,000 per person, because sooner or later we're all going to be bankrupt and more people are going to lose their insurance. But if we make it clear that these are the 3 simple things we're trying to achieve, and here's how we're going to do them, I think we win back the American people and we win this debate and ultimately get the bill passed that we have to get passed.
There's so much confusion over this health care bill, and there's been a backlash against it amongst the Democrats. And I'd like to get a moment to have you define some of the things we've been hearing about. But before we get there, last month, the House and the Senate got together to try and merge their 2 bills. And you've said all along that the House version was much more palatable for the American people. Where do you stand with that compromise measure? You said we're not going to negotiate with a gun to our head. Do you feel there's a gun to your head?
Well, here's the problem is that the Senate bill, we were negotiating the House and Senate bill. The House bill is much better. It's better for New York City. It's better for the country. It saves more money. It has things like the public option in it. It doesn't pass along big costs to New York City taxpayers. The House bill is much better. I think even many of my Senate colleagues would say that. We were in the process of negotiating to bring them together when the Senate realized they didn't have a majority of 60 anymore. They now had a majority of 41, and I say that because when Senator Brown was elected in Massachusetts, the Republicans then could filibuster any bill, and they said we want no health care, and they're going to filibuster it. So we had to stop those negotiations. We don't have 60 votes in the Senate now. So someone said, why don't you just pass the Senate bill as it is and get it to the President's desk? It's just not good enough. Frankly, people say shouldn't let the perfect be the enemy of the good. This isn't even the good. We really need to improve that Senate bill. So right now we're trying to figure out a way to do it. It's very difficult. Listen, when 41 senators say we're going to vote no on everything, when every single Republican in this House says we're going to vote no on everything, there's not a lot of margin for error. And so that's where it stands now. That's why we're having this bipartisan summit next week. Hopefully it's a success, but I'm not holding my breath. We really need to try to push through, and I think it's so frustrating to the American people that somehow 41 became the majority in the Senate, because that's really the case, because now without 60 votes, it's so difficult for us to get anything done.
Well, the president has called for a television roundtable of leaders of Congress, both Republican and Democrat, to discuss this and be more open. And part of the problem is that you didn't have this openness in the discussions in putting this bill together.
Oh, I disagree. Well, let me just say, I disagree with that 100%. We had 5 committees. Each committee, including my Energy and Commerce Committee, had hundreds of hours of debates. Every single amendment was in open C-SPAN, had to put 4 channels on the air just to keep up with all of the debate going on. The only part that hasn't been televised is this part at the end when we're going back and forth. Harry Reid, can you get 60 votes for this? Nancy Pelosi, can you get 218 votes for that? In fairness, I'm not even sure how you televise that, because a lot of it is just trying to figure out where the votes are. But this has been a remarkably open process, so open, in fact. I have people coming to one of my 16 town hall meetings and say, I saw this amendment by this guy was defeated 3 weeks ago in committee. How come you didn't vote for it? People are watching what's going on, so to say it hasn't been open is just not fair.
You were critical in December of the president, but you didn't feel that he was really hands-on. And you said it's about time the president get his hands dirty. Do you think he's now gotten into it? Has he gotten the message?
Yes and no. I mean, I'm all for having this televised bipartisan summit, but I think he's going to learn what many of us have seen for months and months. The Republicans, frankly, and this is their political strategy, they don't want to get a bill. They don't want the president to have this feather. They don't want this to be a success. That's their political imperative. Now, I think it's bad for the country, but I think he's going to learn that. If you ask many of my Republican colleagues, if you got Amendment A or B in, and by the way, we passed dozens of Republican amendments in the process of drawing this bill up, would you then vote for the bill? None of those said, oh, sure, I'll vote for the bill if you do A, B, or C. I mean, that's the problem here. The president has to say, look, we've got a pretty big majority in the Senate, 59 senators. It's not 60, but it's 59. We've got a majority in the House. I was elected to do this. Let's try to get this thing done. All of this machinations and negotiations are not leading us any closer to getting it done. He needs to really lead this debate some, and I'm going to try to help him.
The president seemed to suggest in the State of the Union address that go forward with health care reform, but perhaps scale back, not be as aggressive as he had been with the proposal he had set forth at a time when people were more concerned about economic conditions.
You know, the problem is health care is job creation. When you have every employer has to put 25% of their budget aside to pay for health for their workers, when in Canada they're only putting 4% aside, we're less competitive. When people are losing their health insurance, and so every dime that they have in the family kitty has to go to pay for health care, that is a problem for our economy. When 50% of all bankruptcies are because of people have a health care emergency, that is the economy. So I don't think you separate them. I think you do the opposite. You merge them. You say, look, we do want to do job creation, but in order to do that, we have to fix this health care mess as well. I think the two things go together like hand in glove, and I think the president needs to make that case.
And one of the cases you're making is you would like to see something, you'd like to see Medicare, which right now is for people 65 and over. You'd like to see Medicare for people even younger than that. I want to pursue that in a moment. And also, I'd like to get you, Congressman, for the folks out there who are just so confused about it all, define for us public options, single payer. We'll get all of that in a moment when we continue with Congressman Anthony Weiner. Stay tuned.